Medi-Cal to cover the Part A premium of Original Medicare. Hello, I'm Kevin Knauss with InsureMeKevin.com, and the California Department of Health Care Services has announced that Medi-Cal will begin covering the premium for Part A of Original Medicare for some individuals. Now, Medi-Cal for years has covered the Part B premium for certain low-income individuals. And Part B is the outpatient services, doctor visits, labs, tests, x-rays, and that is about $174.70 per month in 2024. But they had not covered, Medi-Cal had not covered the Part A premium. And Part A is important because that's kind of the hospital coverage. So it's going to cover an individual if they are hospitalized overnight. There's just a set deductible. The Part A also covers skilled nursing for up to 100 days. There is a co-payment for days 21 through 100, but the first 20 days are zero cost. And Part A covers home health services and hospice. Part A is important because you need both A and B of Original Medicare to enroll in a Medicare Advantage plan and or a Medicare supplement plan. So it's important to have Part A, and some people can't afford it. And why couldn't they afford the Part A premium? Well, you have to have worked a certain number of credits in order for Part A to be zero cost. So most people who have worked 10 years and paid Medicare taxes will have Part A at a $0 premium. If someone has only worked, maybe 5 years or only had 30 quarter credits, they would be paying about $278 per month for Part A. And those individuals who have zero work credits, the Part A premium is $505 per month. And people who may fall into this category are folks that have worked abroad for most of their adult lives overseas in another country and never paid into the Medicare system, and then they come back to the United States and they don't have the zero cost Part A premium, so they have to pay for it, and that is obviously very costly. So now Medi-Cal, Department of Health Care Services, in coordination with the Centers for Medicare and Medicaid Services, has what they call a buy-in program, and they're going to be covering the Part A premium for certain groups. One group, individuals with full scope Medi-Cal, people who receive supplemental security income or state supplementary payments, Medi-Cal recipients deemed SSI or SSP, qualified Medicare beneficiaries, qualified disabled working individuals, and individuals in medically needy group who meet their share of cost in a month for that month only. And now the qualified Medicare beneficiary, those income restrictions are posted every year, so your income needs to be below 100% of the federal poverty level. So they have those numbers. You should be able to see them here on the screen. But this buy-in program is also important because there can be a late enrollment period for Part A. Those people who do not enroll in Part A when they are first eligible for it are subject to a late enrollment penalty. However, under this agreement between the Department of Health Care Services and Centers for Medicare and Medicaid Services, there will be no late enrollment penalty. So that is helpful. Now, for folks that already have SSI, they will automatically be enrolled into the program and have the Part A premiums covered. And the text that Department of Health Care Services put out says that the Social Security Administration will be handling that transition, that buy-in. Other individuals can complete a Medi-Cal application at the county level. So if you aren't already in the Medi-Cal savings program administered through Medi-Cal covering your Part B premiums, then you definitely want to apply if you do not have Part A to see if they'll cover that Part A premium. And that will generally be effective the next month. There is no enrollment period, so whenever you go through the process, and it's approved, the next month it will start, and then you could enroll in a Medicare Advantage program, and that will help cover a lot of the cost, and then you have a good network of doctors. So there's a lot of benefits for a lot of people with this new Part A premium buy-in program from Medi-Cal. So if you have any questions or comments, I'll do my best to answer them. You can leave those down below. I will be posting the text of this correspondence from the California Department of Healthcare Services on my website, so you can go there and read everything about it. So for InsureMeKevin.com, I'm Kevin Knaus.